saying that out of every 5 children that are born, 1 die. If you put the numbers together, that's really disturbing.
It is.
And just like one of the officials at the report we read earlier on, saying that no woman should die from childbirth.
Of course.
Originally, it's a thing of joy.
And no child should die
exactly.
before the age of 5.
Before the age of 5.
No, it shouldn't
so
be heard.
when you have these statistics, it's really troubling. And declaring a state of emergency in maternal and child mortality is the right thing to do. But however,
then we need to move beyond
exactly,
declaring a state of emergency.
Exactly. Because
we need to
when
look
it comes
for
to
workable
declaring,
solutions.
exactly, when it comes to declaring state of emergency, a lot has to be done to actually portray the fact that a state of emergency has been declared, making it a priority for women, for children, and for anyone at all who should.
Another issue is the state of the primary health care that should be accessible to all, even at the grassroots. It's still a challenge, and the federal government is saying it's wants to revamp about 10,000
primary health centers,
but then
really beautiful.
All right, we have Vivian Ihekwazu back online now. Vivian, like you were saying, how worrying is this, seeing that the life of pregnant women and even babies has been threatened?
I'm sorry for the audio. Vivian speaking again. It's very concerning when we look at the figures of women dying in childbirth in Nigeria. What we define as childbirth is women giving birth, women dying during pregnancy or during when they're giving birth, or at least 48 days after giving birth from pregnancy complications. The figures are alarming. We have about 58,000 women who die every year from childbirth, and they do not get the experience of enjoying their children. And this accounts for about 19% of deaths globally. So declaring it a state of emergency is necessary right now because the figures...
As necessary as declaring a state of emergency is, we need to understand beyond the declaring a state of emergency, what workable solutions should we be proffering at this time because people are dying?
Okay. One thing we need to know is in Nigeria, about 35% of deliveries are in health facilities. What that means is trained personnel are helping women give birth, but 65% are outside health facilities. So these deliveries are underreported and unexplained. So we have a lot of deaths in the community. And Nigeria Health Watch, in consortium with SHA and FESA, they started a project which is looking at accountability for maternal deaths focused mainly on community. Because we know many women die in the community. And the causes of death of women, we know are mainly system failures, which means access to adequate clinics. So do they have a clinic near them? Also, do they have trained personnel near them? So these are some of the things we feel are concerning. In the community, there are traditional and cultural factors that we have to acknowledge are adding to the burden of maternal mortality. And these issues need to be addressed. So with MPHCPA looking at this, the community is one of the biggest places where women are giving birth. And there needs to be a lot more focus on making sure that when women go into labor, whether they're in the community, they have access to a health facility and trained personnel. With that,
all right, Director of Programs, Nigeria Health Watch, Vivian Ihekwazu, thank you for your time on TVC Breakfast.